I'm Dr. Sheehan from Sheehan Natural Health Improvement Center, and today we're going to talk about one of my favorite topics, iron overload. Why is it my favorite topic? One of my favorite topics? Because we do functional blood chemistry, and you see this rampant, and you see dramatic cases get better when you handle it. One of the cases was my wife. My wife had chronic fatigue, anxiety, depression, chronically achy joints, hormonal issues, and she was always getting sick. And we were like, what the heck is wrong? And she looked at a video, or I think she listened to a podcast by Chris Kresser called Iron Behaving Badly. We will put the link down below for that if you want to listen to it. Brilliant podcast, brilliant class. And he talked about, I think it was 1 in 9 people actually have a genetic tendency towards too much iron. Now, I'm not talking about hemochromatosis. Hemochromatosis is when you have, basically you get genes from your mother or father. If you get one of the genes that selects for too much iron, I'm making this real simple. If you get one of them, that means that you most likely have iron overload. Like my wife, we did a genetic test, she had those genes. But let's say you get genes from both your mother and father, you can get what's called hemochromatosis. Hemochromatosis, when you have sky-high iron, you must have that assessed medically and taken care of because it can kill you. Laura, because she just has a little bit too much, it's not like a medically diagnosable condition. It's more like she has a tendency there. All she has to do is give blood once every 2 months and she's fine. It was amazing. When she first gave blood, all of a sudden, like in a week, she was like, I'm 80% better. And she has remained 80% better. It is awesome. So, let's talk about it. So, and I have seen a lot of people come in with this. I had one person, it's like story time today, but I had one person who had been to see a lot of different doctors, holistic doctors and everything. She had a lot of abdominal pain and sinus infections. Immune system issues, abdominal pain. She had a lot of abdominal pain. You know what they did? They cut out part of her small intestine and large intestine, thinking that was going to fix it. It did not fix it. Okay, when she came in, she just had iron overload. She gave blood, and then we handled the immune system issues. Her sinus problems went away, and her stomach pain went away. Crazy. Right now, I have a person that's coming in, and he has chronic pain all over his body, fatigue, all sorts of different things. His levels were sky high. He started giving blood, and now guess what pops out? Lyme disease. He lives in the woods, is always hunting. Okay? So anyway, we see this again and again and again. All right. So what are the symptoms of iron overload? Abdominal pain. Usually what's happening is that iron tends to deposit a lot in your pancreas and your liver, and it causes pain. People don't know it, but it causes abdominal pain. Achy joints, it also deposits in your joints. One thing, my wife was always going like this. She was always massaging her hands. She's a massage therapist. She doesn't do too much of it. But she used to give, I don't know, 5 or 10 a week. But it was killing her. Okay? Not anymore. Depression. It also, iron will deposit in your brain. It causes inflammation. And so you'll get a lot of anxiety and depression. One of the models for anxiety and depression right now is chronic inflammation. You can go and Google that a lot. Look up chronic inflammation, chronic infection, depression. You're going to see there's a huge link. But it will cause a lot of depression. Conversely, it will also cause a lot of anxiety, okay, because it causes inflammation in that brain. Immune system issues, immune system stress. A lot of these bugs that live in our bodies and that are really nasty, especially bacteria, tend to live on iron. It's part of their life cycle. And so if you have too much, you grow too much. It's really obvious. All you have to do is decrease that level and those things get better. Weakness. It goes right along with depression, anxiety, and the inflammation and inflammation issues. Excuse me, thyroid issues. This is amazing. I remember looking up, especially in people with hyperthyroidism, if you have iron overload, your increase in hyperthyroidism increases 8,000%. Okay? 8,000 times. 8,000 times. That is incredible. Okay? I've had people come in with Graves' disease before, and they have too much iron, and it's like, you work on getting their iron down, supporting the immune system, and their Graves' disease goes away. It's incredible. You're not treating Graves' disease, you're basically taking care of what's going on in the body. That's it. It's called a functional assessment. Okay, so these are the labs that you look for. Notice that these labs down here, you've got what's called TIBC, total iron binding capacity, UIBC, unbound iron binding capacity, or something like that. But basically, that's how much room you have for iron. Transferrin saturation, that's the primary protein in the blood that your body uses to shuttle iron. Serum ferritin basically means, serum iron, which is basically how much iron you have bound to your proteins. And then ferritin, which is a storage form of iron. I have never seen a doctor test for all these, but that's what you need to do to actually test for them, okay? Now I'm gonna tell you, okay? People have a tendency to diagnose themselves. You can try to do it. But what I would do, okay, if you are looking at this, okay, look this over and see where you fall in there, okay? If you have iron overload, what I will tell you is that your TIBC and UIBC will be low because they are what's called an inverse marker. You have less room to store iron. They're going to be low. Your percent transferrin saturation, serum iron, and ferritin will be high. Okay? It is like that. Rarely will you see, put it this way, you might have, usually to make the proper analysis, you will have at least 4 of those outside the range. Now, on the next video, we're going to go over iron deficiency. If you are the exact opposite of this, you have iron deficiency. It is that simple, okay? If you don't know, call our office or call a functional medicine doctor. We have another video on how to find a functional medicine doctor. Basically, you just Google one and you start calling around, or you ask your friends, do you do functional medicine there? Do you do functional blood chemistry? That's how you find one. If the person says, no, I'm a medical doctor, okay, by the way, a lot of chiropractors are getting into functional medicine. A lot of medical doctors do what's called allopathic medicine, which is like insurance-based medicine, and disease care, okay? Functional medicine is more preventive, okay? But basically, I'm not going to tell you how to diagnose these. You can diagnose this, theoretically. You may need assistance with this if you are outside of these, okay? Just remember that. So when you have iron overload, your TIBC and UIBC will be low, your transferrin saturation, serum iron, and serum ferritin will be high. And you will see it in a majority like that. And usually it's very obvious, okay? If it is not obvious, then you might not have it, okay? Like I said, consult a professional. So, how do you improve iron overload markers? First, we have that video on the PAGE diet. You do either the PAGE diet, phase 1, or phase 2, depending on what your blood sugar is. Basically, if you have a blood sugar problem, do PAGE phase 1. When it gets better, do PAGE phase 2. Very simple. The PAGE diet was originally made to balance your blood chemistry, especially your minerals. Next, go give blood. Okay, you can give blood once every 2 months, okay? Unless in the most severe cases where they need more, in which case you need a letter from a medical doctor. But you can just give blood by the way, when you give blood, don't tell them, hey, I've got a condition where I have too high iron. They will block you. Most medical professionals don't know that when you have too much iron, and then there's hemochromatosis, and there's a difference. Hemochromatosis, like I said, is a life-threatening one. And they think that everything's hemochromatosis. Someone says they have too much iron, and so they'll be like, well, that's dangerous, and they'll block you from doing it. Don't do that. Just say that you want to help another human being, because by giving blood, you will be helping another human being. You're not giving toxic levels to them. Okay, remember that. Remember, the people that need blood donations need blood. Okay, so anyway, give blood once every 2 months. That's what Laura does. Iron blocking strategies. First of all, I never give them. Okay, the reason why I don't... A lot of people will say, well, should I cut red meat? Should I do this? Should I do that? The problem is when you start altering your diet too much, a lot of these things that are high in iron are also high in B vitamins, and they're high in other minerals that you need to process the iron, okay? You don't want to do that unless you absolutely need to. The iron blocking strategies you only employ if the person cannot give blood, either because of the fact that, like I have one guy who needs to give blood, and he just gets way too anxious. He likes sweats. Ends up in a pool of sweat. No, we're not going to torture him. I have another woman right now that actually is on chemotherapy. She cannot give blood. That's dangerous. It's dangerous to other people that get it. I have other people that are Jehovah's Witnesses, so that's a religious exemption. So we're going to give them an iron blocking strategy. So what is the iron blocking strategy? Well, let's remember this, okay? The most utilizable form and the most highly absorbed form of iron is what's called heme iron. Heme iron is the iron that's found in animals, okay? And then there's non-heme iron. Non-heme iron is the one that's in fruits, vegetables, nuts, vegetarian sources, okay? Now, here's the catch. Non-heme iron is not really absorbed. In fact, a lot of the vegetables block iron absorption. So like something like spinach, even though it has tons of iron, you're not going to absorb it. So don't worry about it. Worry about the heme iron, the animal iron. Like I said, though, you don't want to go low animal protein because then you'll be deficient in other things. But there is one thing that is known to block heme iron, and it is calcium. So there's a real easy way to do it. You can eat 1/2 cup of dairy each meal. So like a 1/2 cup of milk, 1/2 cup of yogurt, 1/2 cup of kefir, something like that. As long as you tolerate dairy, easy to do. Okay? We always make sure that ours is raw dairy. We live in like the raw milk capital of the world. We have a lot of Amish friends and stuff like that. So we always have plenty of dairy in there. And Laura drinks plenty of that. And she does lots of kefir and yogurt and stuff like that. Okay? The other thing that you can do, another form of calcium that works also to support your immune system, bones, helps relax you and supports the musculoskeletal system, is what's called calcium lactate. This is from Standard Process. You just need 3, actually it shouldn't be per day, per meal. Excuse my scribble, but it should be 3 calcium lactate per meal, okay? That calcium lactate will help to block iron absorption. The other thing, there's a supplement called lactoferrin. I don't even know the company that we use. Just look up lactoferrin. If you take 1 per meal, that will also help to block excess iron absorption. Okay? So hopefully that helps you, and I'll see you in the next video.